Well, a woman from the Ribble Valley is calling for more help for people suffering from Lyme disease, with more early diagnosis and treatment from GPs and more public awareness how to prevent it. Mother of 3, Pamela Fitzgerald, was diagnosed with Lyme disease this year. She's been unable to work since contracting the condition and says it's completely changed her life. Speaking to our reporter Anna Jameson, she says she can't understand how something the size of a poppy seed could be so damaging.
My partner Stuart has a house in Scotland, and we were up there for the summer, and we spent a lot of time in the garden cutting some bamboo back actually. And I was in the shower one night and I thought, I've banged my leg. It felt bruised. So I looked and I couldn't see anything. I got out of the shower and Stuart had a look and he said, you've got a tick. So he took the tick out and then I said, look, it's got a funny rash around it. I said, it's like a bullseye rash. And at the time we were both completely ignorant to Lyme disease. And Stuart said, I think that's just, like an allergic reaction rash. I've got it all out. It'll be fine now. So it was about 2 weeks later that I started feeling a bit fluey, and that went on for a couple of weeks. And Stuart said, I think you need to go to the doctors. And I was like, I'm not going with a cold. And he said, it's a bit more than that, Pam. You've got a fever and you're really quite unwell. So I went to my GP and he listened to my chest and said, I think you've got pneumonia. I'm going to send you up to the hospital. So I went up to the hospital and they said, you've got a crackle on your lungs and we'll treat you for pneumonia. So I had 2 lots of antibiotics. Didn't really improve very much. I only went to A&E if I got more symptoms. So in all, I was admitted 6 times. And then I was actually sat here on my own. It was a Friday afternoon and I thought, right, when was I last well? When did I last feel well? I thought I was all right when I went back to work in September. And I thought, I was a bit unwell though after that tick bite. Crikey, I'm sure there's something that you can get from tick bites. And I Googled it and it came up Lyme disease. And I looked and thought, oh my goodness, I've got all these symptoms. So I rang my GP and she said, Pam, this is like the missing piece of the jigsaw. She said, I couldn't understand why you weren't responding to any of the treatments. She said, but that's why, because the underlying cause was still there.
How is Lyme disease at the moment affecting your day-to-day life?
My major symptom is that I have a constant migraine pain, but instead of being just at one side, it starts kind of in my eyebrows, goes over my head, down into the back of my neck and right down into my spine. I've also got facial palsy. It's quite bizarre because the right hand side of my face is numb, but it's the left side that doesn't move. But the biggest thing is the tiredness. I can make a cup of tea and then I need to sit down. I can walk maybe 100 yards and then need to sit down. So it's very, very debilitating. Last week I was back to not being able to get in and out of the bath on my own.
You're not working, are you, at the moment? It's completely put a halt to that, really.
Yes.
How does that feel?
Terrible, because I think as a society we gain a lot of identity from our work. I'm not saying it's everything, but when you're not working, and it's the social side of things, and I just feel quite useless, really, at times. So sorry.
Obviously.
To me, I'm the one who cares for everybody else. I look after everybody else. And to accept help, never mind ask for help, is so difficult. Although I'm so lucky that my family and friends are absolutely amazing. Absolutely amazing. I couldn't have got through it without them. But it is really difficult. I haven't worked for 11 months. But what I try and do each day is think about everything that I can do.
It does change people's lives, doesn't it? And it's not something that an awful lot of people know a lot about. Let's try and find out more about the condition that that Pam is living with. Natasha Metcalf is the co-founder of Lyme Disease UK. It's a national patient support network for Lyme disease sufferers and their loved ones. Thanks for joining us this morning.
Hi, you're welcome. Good morning.
Not everyone would have heard of Lyme disease. What can you tell us about it?
Well, often it's thought of as being confined to hotspots around the area, in rural areas, but actually people are finding it in urban parks and gardens. So the message is that it can be found all over the UK. The other problem is that doctors are not very familiar with picking it up. So in our community, we see a lot of people coming in with rashes, which are obviously Lyme disease. They're called an EM rash. So they can either be a bullseye shape, or they can be atypical. And that's the crucial point where people can be treated, because that's actually diagnostic of Lyme disease in itself, and it doesn't require any testing. So we're seeing a lot of cases being missed, which should have had treatment straight away.
So, and people get it through being bit by ticks, am I right there?
That's correct, yes. And more evidence is needed into whether the illness can be transmitted via other routes.
Okay, and what would you like to see be done? Because better treatment, better understanding of it.
Well, absolutely, better doctor education. So there's actually an online e-learning course created by the RCGP and the charity Lyme Disease Action, and it's had incredibly poor uptake amongst GPs. And if more GPs took that, then a lot of the problems that we see in our patient support network with people being misdiagnosed would actually be addressed. So that's the key thing for doctors to do to help us.
Okay, and if people want more information about it, what should they do?
Please come and take a look at our website, which is LymeDiseaseUK.com, and you can find lots of information there about symptoms and also prevention and tick removal techniques.
When you talk about tick removal techniques, is there a way to remove a tick?
There are a few different ways, actually, and the most important thing to do is try and use a tick removal tool, and also to not smother the tick with Vaseline or try and burn it off, or distress the tick in any way, which can cause it to regurgitate its stomach contents and pass on the infection. So it's very important to learn how to remove a tick safely so that you don't increase the chance of becoming infected.
Okay, and there's more information on your website?
Absolutely. And we're campaigning hard around the country to try and distribute, awareness information to as many places as possible. And we're also working with MPs and MSPs in Scotland, with stakeholders in the NICE Lyme disease guidelines, which are coming out soon. So we're just trying to spread the word as much as possible.
Okay. Thank you very much for joining us this morning. That is Natasha Metcalf, co-founder of Lyme Disease UK.